United Nations World Health Organization country representative, Ms. Shinaz A. Halabi, the President of COSAT in absentia, ikakhulukazi ngiphakamise okuyena ozile la wazokhuluma egameni lakhe. The President of SALGA, ukhansela Bheki Stofile, umhlonishwa umeya walapha Ogwini, umhlonishwa uSikhumbuzo Mqadi, nomhlonishwa umeya walapha esikhona eReyinkonyeni, umhlonishwa ukhansela uZodwa Mzinje, abahlonishwa o-deputy mayor nosomlomo, amakhansela onke akhona, SANEC deputy chairperson for business, Dr. Tsehofatso Hopane, the chairperson of SANEC Civil Society Forum, Mr. Solindugu, TB Ambassador, Ms. Ntswaki Mosia, bonke abakhethekile abakhona la endlini ngiyabaphakamisa, abeindaba namaphoyisa, ngibingelela nje konke umphakathi okhona la wasogwini KwaZulu-Natal nangaphandle koKwaZulu-Natal. Bakwethu, ngiyathobeka kakhulu ukusekela mongameli wethu ubaba uMashatile kanye nethimba longqongqoshe kazwelonke ukuthi bavakashele KwaZulu-Natal ngomsebenzi osemqoka kangaka futhi obuyisa ithemba ngokunqotshwa kwesifo sofuba. Ngoba namuhla sihlangene ngokuzobhunga kabanzi ngalolu suku iWorld TB Day esilugubha namhlanje lapha eReyinkonyeni municipality. Sikanye noba wonke ngoba njengoba silapha umhlaba wonke nakungaza. Kepha kubalulekile engifuna ukuphawula kakhulu ingxoxo ezogcizelelwa iphini lenhloko yombuso lapha eNingizimu Afrika okufanele kube umlayezo sonke esophuma nawo siyosebenzisa ngaphandle. Ngifungela kakhulu nezingane zami kade ecula lapha emzuleli amazwi ecula nje nami engithose kakhulu, nami nganguthisha ngangibhidisa nami manje nivusa usinga mangabe senicula kahle kangaka. Esikubona namuhla ngiyakhathazeka nje mhlonishwa yasekela mongameli ngoba leya ngxenye ngale bayaxoxa isikhathi esiningi kuzo zonke izinkulumo. Manje ngiyakhathazeka ngoba phela sonke size lapho ukuzolalela ukuze sisizakale. Kodwa manje izinga lokuxoxa mali phezulu ukhona abanye abaphazamiseka bengakazi ukuzwa. Bese emveni kwalokho masiphuma lapha siyoqhubeka nempilo as if normal. Kanti sibhekene nengadla nenkiyankiya enkulu utavatava esibhekene nalo lukhulu kakhulu. Esibona namuhla ingxenye yomkhankaso kazwelonke oshayelwa ungqongqoshe wezempilo uDkt. Aaron Motsoaledi uyamsana nosekela mengameli ubaba Mashatile ongishampeni nomgqugquzeli weSouth African National AIDS Council osolayo njengelizwe ukulwa ne-TB kanye ne-HIV. Ngibala ngesondeza lezifo ngoba uke washo esikhathini esedlule uDkt. Motsoaledi ukuthi zihlala njalo zifuna ukuhambisana. Ngaphansi kweSANEC uhlelo lokulwa ne-TB kuzwelonke siyazi ukuthi lihlanganise ukukhukhulela ngoqo wazo zonke inhlaka zomphakathi kusuke enhlanganweni zomphakathi ama-NGO, abaholi bemabhizinisi, abezenkolo, abaholi bomdabu, abaholi abasebenzi kanye nabamele abaphila negciwane le-TB nasebelinqobile. Nalapha-ke esifundazweni sethu sinalo uhlaka lwesibizo ukuthi i-Provincial AIDS Council ebhekene ngqo nalo msebenzi lona. Bakwethu ningixolele ngoba ngizobe ngiboleke nolimo ongasilona lolu silizwayo ngomningi bethu la ukwenzela nabahlobo bethu abasivakashele ukuba bezwe ukuthi KwaZulu-Natal ibibika ithini. KwaZulu-Natal is the second most populous province after Gauteng According to Stats SA mid-year population estimates, the province is home to about 21% of the total South African population. We have in KwaZulu-Natal a total of 798 facilities across the province rendering TB and HIV services. The highest number of the TB notification cases in the province, omasipala abayishumi nambili, ikakhulukazi iTheku, kube nabanye omasipala nababahamba phambili obufana noGu, uMgungundlovu kanye neKingcetshwayo neLembe. Lezi ndawo lezi bakwethu zibukeka engazi ukuthi zihamba phambili, ikakhulukazi la sikhona egama lakhe. Njengoba ngithi ngiyakhathazeka uma kukhona ukuxoxa kulo mhlangano obaluleke kangaka, ngoba okusilethe lapha egama lakhe ngoba ngempela sibone ngathi izibalo zithanda ukuba zimbi kakhulu lapha, ngoba lapha nje egama lakhe almost about 2113 cases. Umzinto clinic inomdoni with 909, Mfundo Arnold Elushaba Community Health Center in Mzumbe with 788, St. Andrews Hospital in Mzwabantu with 515. Manje ke bawethu lezibalo lezo zithumela umyalezo ukuthi kufanele sisukume ngempela kube khona esikwenzayo. Njengoba sihlangene lapha ke namhlanje, umhlonishwa wasekela mongameli, umhlonishwa ungqongqoshe Motsaledi, nabahlonishwa bonke nabonke abakhona ababalulekile lapha. Ingoba umyalezo wethu ofanele siwudlulise ukuthi wonke umphakathi kumele ufake igxalaba uma sifuna ukuphumelela siqede iTB. Sithi iTB ayisona isigwebo nokufa. Kubalulekile ukuba sisukume sonke sibambisane, lokho singakwazi ukwenza ukuba siyobheka siyoyihlola, nanokuthi laba sebeyihlolile bathola ukuthi sebenayo bangakubalekeli phela ukuqhubeka bathathe le mishanguzo ukuze iphele ishabalala emzimbeni wami. Today we commemorate World TB Day, a moving reminder of the devastating impact of tuberculosis on individuals, families, and communities worldwide. As we gather to mark this significant day, we reaffirm our commitment to joining forces in the fight against TB and accelerating efforts towards eliminating this disease as a public health burden. In KwaZulu-Natal, our multifaceted approach is built on 4 pillars: raising awareness, promoting access to care, advocating for research and innovation, and strengthening partnership with all stakeholders. This comprehensive strategy is amply reflected in the 2025 World TB Day theme, which is Yes, We Can End TB, Commit, Invest, Driver. To eradicate TB, we must commit our time, resources, and energy to this noble cause. In KwaZulu-Natal, we will continue to support the implementation of the National TB Strategic Plan, with a focus on amplifying the End TB campaign. Our MEC for Health has announced a range of initiatives, including TB screening and tracing of all TB, all HIV-positive pregnant women for TB, therapy for HIV-positive individuals, accelerated cases and testing, integrated service delivery for HIV and communicable diseases, robust communication and media strategy, community engagement and advocacy, strengthening partnership among stakeholders, increasing funding to enhance diagnosis, prevention, and treatment. We must confront a pressing concern that persists in our society. Tuberculosis, despite being a treatable disease, remains shrouded in stigma and shame, hindering early detection and effective treatment. Embarrassment not only the rates suffering of those afflicted, but also undermines our collective efforts to combat this scourge. As we mark this significant day, we are reminded that TB is not a moral failing or a curse, but a disease that can be cured with timely intervention and proper care. However, our fight against TB is complicated by its intricate relationships with other illnesses, such as HIV. The core infection of TB and HIV present a formidable challenge, necessitating a comprehensive and integrated approach to healthcare. We call upon all members of our community to unite in the fight against TB. Siyamemezela ukuthi bakwethu sonke asibambisane sibe munye ekulweni ne-TB emphakathini yakithi. Indawo lapho KwaZulu-Natal is unique with its dynamics, which make a collaboration with traditional leaders the cornerstone of success public health initiatives. The fight against TB in particular requires collective commitment from traditional leaders, government, and civil society. By working together, we can harness indigenous knowledge to combat this disease and create a healthier, more prosperous society. Bawethu lawo mazwi ami kuphela engibona ukusekela mongameli angiwathule ngoba ngiyazi ukuthi inkulumo izothulwa wena okuyona semqoka. Kodwa mina ngidlulisa nje umyalezo egameni lesifundazwe sethu KwaZulu-Natal wokuthobeka kakhulu ngokuza kwakho la esifundazweni saKwaZulu-Natal. Siyazi ukuthi ubungathatha isinqumo sokuya noma yisiphi isifundazwe, kodwa ngoba you care for the people of KwaZulu-Natal, you decided to bring this campaign to KwaZulu-Natal. Because you care about the people of Oku, you decided that we come here. Because you care about the people of Renkonyeni, you decided that we come here. Ngakho-ke siyathobeka kakhulu for ukuza kwakho lapha esifundazweni sethu KwaZulu-Natal, ikakhulukazi wezempilo kuzwelonke, okusho ukuthi-ke mase kufike bona sekufika bokugcina. Umuntu osengahlala phansi athi lo mkhankaso ofanele siwuzile sifika kwabo usenda umlayezo omkhulu kakhulu ukuthi sonke masisukume sibambisane ukulwisana ne-TB, ukwenziqinisekisa ukuthi abantu bayayihlola, ukwenziqinisekisa ukuthi abantu abanayo abavumeli ukuyeka ukuqhubeka ne-treatment, ngoba lokho kuzokwenza phela isabalale i-TB uzuthelele ngisho nehlobo zakho. Ngiyathokoza ngizokusho ngelinye ilanga umhloshini noma lesa sijwayelekile manje ke angizukusisho-ke oyo manje ke ngisisho-ke isiqubulo. Ngiyathobeka
hawu bebhasi. Hayi, siyabonga kakhulu, siyabonga Mthemba. Isiqubulo esishoyo ke namhlanje ukuze sikwazi ukuthi uPremier angasi yebo mina nawe sizoyinqoba noma singayinqoba i-TB. Nimzwile ukuthi usihlale isho. Ngicela siphinde futhi ithi yebo mina nawe singayinqoba i-TB. Asiphindeni futhi yebo mina nawe singayinqoba i-TB. Hayike kodwa angibezwa beyisho ngapha. Ngiyasola ngathi asiphelele ngathi abeka abantu baseRenkonyeni la bakhona. Abantu baseRenkonyeni. Oh ibona laba bangasilaleli. Abantu basemzwa abantu bona bakhona. Baphi? Awu baba ncane kangaka. Abasemzumbe bona. Nangu nomeya ukhawulo uyaphakamisa lapho. Abasemdeni bona bakhona. All right, ngizocela ke isikolo ibonga ucele junior secondary school iphinde ibuye izosipha i-item i-musical item eyodwa. Ngicela sibuye ke stage bantabami. Ngesikhathi beseza estage ngifuna ukuchecka la ukuthi siyayazi ngempela noma futhi besilalele yini ngesikhathi kukhulunywa. Ukhona owazi ukuthi uma usune-TB uzibona ngani? Khona ngikuphethe la engizokupha kona nangithola impendulo e-right. Ukhona waziyo? Ngempela Hayi ngathi lo 200 rand wama niwufuni. Niyawubona? Okay, nangu dadewethu la weroke elimhlophe. Yeah, wena. Ngicela ningipheleni mic. Nay mic. Nomhlonishwa ukhawula ufuna 200 rand wami. Maye. Hayi abahlonishwa sukuma dadewethu khona bezokubona. Nangiya lapha. Uma nje sesithi uyazisola ukuthi une TB usukunjani usukunani. Like day off Lusanda.
Uma uzisola ukuthi une-TB ubona ngokuthi ukhwehlele okunganqamuki uthwese emzimbeni awehle emzimbeni hawu madoda
uma ngithanda nje ukuthi sengikhuluphele kakhulu sengifuna ukwehla kusho ukuthi ngine-TB.
hayi phela usuke ungadayethi
nakho
ewe usuke wehla nje hayi usuke uthanda
usuke ungakuhlelanga ukwehla emzimbeni ungahlelanga. Ngiyayizwa leyo ndaba. Hayi asimbambe kumama ngoba ngifuna ukunika nalabo abanye ithuba naye ngimnike u200 rand wakhe nawo-ke usebenzele niyambona. Hayi-ke usabaleje ama-symptoms amabili phela. Wathi uma ukhwehlela ungakhawuli kuze kuphele u2 weeks. Wathi uma ngabe wehle emzimbeni ungahlelanga usunama-symptoms. Nangu udadewethu laphana ofaka itop epink. Ngicela usukume mama. Yebo. Shesha Lusanda. Ngathi ngifuna udayethe nje khona uzokwazi ukugijima. Yebo ma ubani wakabani?
uMakhosi wakaXolo.
Yebo sisi.
Suku mawulele. Enye impawu.
Nakwenzekani ebusuku?
Ebusuku mawulele ujuluke.
Uma ngivele ngijulukela nje ebusuku ngoba ngijuluka kusho ukuthi sengine-TB. Animlungisele imic yakhe iphinde icime.
Yebo. Ayingoba uma ujwayele
hayi ngathi abafuna uyithole le mali ubani lo nomona kangaka. Cha uyayiphendula inkinga imic yakhe ayiphethe.
ngithe ngimbe
Bekusekuthina dadewethu. Umbuzo wesithathu engizowubuza ukuthi uma usunawo lama-symptoms uwenze njani? Uma usuzibona ukuthi ngathi i-TB ikuphethe wenze njani? Ngifuna wesilisa-ke manje ngoba sengibanikile abesifazane. Sifuna la nangoza la wehembe. Yebo wena-ke weskimu sondela-ke dadewethu.
Yebo ngithena ukujuluka ebusuku mawulele. Kwesinye isikhathi ke vele kuyenzeka umuntu ajuluke nje kodwa lokhu akubi ukujuluka okunormal. Uma ukuthi uyajuluka ujuluka kakhulu. Noma ukhwehlele igazi. Okwamanye ama-symptoms.
Simnike lempahla. Uthi ujuluka shisa, ujuluka ekubanda, ujuluka ongajwayelekile. Ukhwehlela uzukhwehlela igazi nayo ke dadewethu. Simnike ne-USB. Ngifike sengibuza nangumfana wami lana ukuthi uma usunawo ama-symptoms e-TB usenjani-ke ngempela wozababa?
Sanibona. Ninjani? Igama lami Siphelisihle Ndabankulu. No, uthe yini? Utheni? Oh, uzivalele endlini. Ungazulu.
Hayi, uSiphesihle uright kakhulu. Uright kakhulu ngoba phela nawune-TB, uma ungakabi ne-treatment, angithi iyathelelana. Ngifuna ukwazi ukuthi uyinakekele. Kodwa into eyenza ukuthi ngimnikeze kakhulu ingoba uyazama bakithi, ukuzama kubalulekile. Ukuzama kubalulekile, sengizothatha isandla sokugcina-ke ngapha. Nangu udadewethu wesikipha esi-black woza lapha. Ngikhombe eduze. Akeza umfowethu lapha weyibuko nesikipha esi-navy. Ngikhomba wena njengoba ukhala kangaka. Hayi wena nange lapha. Woza mama. Uma usune-TB wenze njani? Na uyisola ukuthi une-TB wenzani?
Uma uzisola ukuthi une-TB, uyahamba uye ekliniki, ufike utheste khona, ulinde ukuze kuphume ama-results ukuthi ube ne-sure ukuthi unayo i-TB.
Ushayile niyamuzwa? Uyahamba uye-TB, uye ekliniki utheste, kubonakala ukuthi ama-results athini. Uma sebuyile-ke ama-results, kuthiwa phuza amaphilisi, uwaphuza isikhathi esingakanani, uwaphuze kanjani?
Sanibonani. Niyaphila? Nami ngiyaphila, ngiyabingelela nonke nje la. Njengoba nikhona nokongqongqoshe nobani ngiyabingelelana. Ya, bona TB. Okay. Bona TB uyajuluka. Okay. Bese une-TB. Uyahamba. Bosobonile ukuthi unayo, uye emtholampilo, bafike bakucheke emtholampilo, ebesogwenya amaphilisi, bebethi 6 months, bebethi unyaka, ulandela 6 months abakutshela wona, uthi treatment 6 months, uphinde babethi unyaka, ulandela lo mthetho, ngiyabonga.
Uthi uma ngabe usuthola i-treatment uyiphuza 6 months ungakhawuli, uphuza usuku nosuku. Niyizwa leyo ndaba? Siyabonga kakhulu-ke. Ngicela sendove kwiBongucele Junior Secondary School isipumucu bese siyabuya siqhubeke nohlelo lwethu.
kumbule kaya. Mama nyakotuga ngomso. Mama 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 kumbule kaya. Mama ngikumbule kaya, mama nyakotuga ngomso, 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 mama ngikumbule kaya. 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 Mama nyakotuga ngomso, mama ngikumbule kaya.
Siyabonga kakhulu asiyishaleni izandla izingane zethu. Angikaze ngikubona ukuhle okunje. Sizocela ke ukuthi siphakamise ungqongqoshe wezempilo ubaba uMthwaleli ozosipha ama remarks ebese yena esukumisela uDeputy President okuyena ozosipha imessage esize ngayo namhlanje. Minister.
Thank you very much, Program Director and MEC for Health in the province of KwaZulu-Natal. Let me take a hike from the protocol already well established by the Premier and not repeat all the people he has acknowledged. He has done it for us. All I can do is to acknowledge His Excellency, the Deputy President of the country, and the Chairperson of SANAC, also acknowledge the Premier himself, Ubabantuli, and the chairperson of civil society and co-chair of SANAC, as well Deputy President, to take this opportunity to welcome into the country Meshenas El Halabi, who has already spoken here on behalf of United Nations family. She is the country representative of the World Health Organization. This is her first major public event representing the World Health Organization. Please give her an applause. Welcome, welcome, Shenas. She's our neighbor. She comes from Botswana, so she's very much at home here, even though she was sent from Geneva to come and represent us. The reason that she's here is actually an indication that the disease that we are dealing with is a global problem. It's not only a problem for us in South Africa, it's a global problem. Now today is a World TB Day, as we have already heard in the past. But today's World TB Day is very special. I want you to know that. It's not like the other World TB Days we have had. This one is very special because the Deputy President is going to do two things today. One, is going to talk about World TB Day, as he has always done every year. That he's going to do. But the second thing, which he has never done before, is to launch a campaign called End TB Campaign. We have decided as a country that this disease called TB must go away. We don't want you to get used to the idea that we are living with this TB. Every day will come and talk and give speeches and all that and go away. At some stage, TB must come to an end. And we believe that must happen from today. In Chinese, there is a saying that a journey of 1,000 miles starts with the first step. Today, we are going to travel this journey of 1,000 miles. Today is the first step. Now, what is this MTB campaign? What will be happening? The Deputy President has launched a scientific mathematical modeling called Tembisa. Township, a Tembisa, a promise. That modeling has shown that if in this country we can do for 5 million people every year and screen them for TB, and those who have got TB, we put them on treatment, we are likely to bring it to an end. So today is the first step towards this Tembisa model to look for 5 million people. On the 25th of February, at Kisani Baragwanath Hospital and Lillian Goy Community Health Center, we launched another campaign on looking for 1.1 million people who are HIV positive, who must be put on treatment. We launched that campaign because I'm sure you have heard about something called 95, 95, 95. To reach our 95, 95, 95, we need 1.1 million people. Now, this 1.1 million people who are looking for, we know them. We know them because they've tested and they are positive, but they are not on treatment. We know them. And so we have got a fairer idea where to look for them because we know them. They came to the health sector and tested for HIV, and they were found to be positive. Some of them even started treatment, but stopped it on the way. So we know them. 1.1 million campaign. Now today, this campaign we are launching, looking for 5 million people. Unfortunately, we do not know them. Unlike the 1.1 million, these 5 million, we do not know them. We're going to search for them. And how are we going to search for them? 3 things are going to happen in this campaign, which the DP is going to launch. 3 things going to happen. Number 1, anyone who has got TB in this country, we want all their family members to open for us their homes so that we come and screen them. I want to repeat this. All the patients who have got TB in South Africa, we need to screen all their family members. And today we are begging you, please open your home when health workers come. Because the person we know is this one with TB. We don't know the rest of the family members, but we know the one with TB because that person is on treatment. That person has come to our health facilities. So we are going to say, please show us all your family members who you are living with. We want to test them. So we are begging you today to understand why this campaign is launched by the DP himself. It's a huge campaign, bigger than the Department of Health. So open your homes. We want to come and screen you and put you on treatment if you are found to be having TB. The second thing, we will encourage all the HIV positive people also to test for the simple reason that TB and HIV/AIDS lie going together. After all, 80% of all the people who have got HIV, if they pass away, is because of TB. We know that already, it's not a guesswork. So we'll ask them. Lastly, anybody who has had a treatment for TB, we would like to follow them up for 6 months, twice for at least every 6 months rather, twice, to make sure that TB comes back. I will also add, those who have got diabetes, let's see for sugar, if you know you have got it, please make sure that you are screened. Because people with diabetes very, very easily develop TB. Now, the MEC here was giving you caps or presents after you answered some questions about the symptoms of TB. Coughing, chest pains, night sweat, loss of appetite and loss of weight, general body pains and weakness. Those are the symptoms and signs of TB. But we are here to warn you. Unfortunately, my leaders and the rest of us here, unfortunately, there are people who have got none of those. They are not coughing, they've got no chest pain, they are not losing weight, they are not losing appetite, they are not sweating during the night, but they've got TB. That's the unfortunate part. They've got TB. And even without these symptoms, they are spreading it. Because TB is spread in the air, they are spreading it. So that's why it's so important for us to screen people. Yesterday, in the meeting, in the community hall there, I said something and people complained. But unfortunately, I'm saying it again today. That while TB generally affects people from lower socioeconomic groups, TB can affect anybody. So what is that we said with people? I said the only way to stop yourself from having TB. The only person who is safe from TB is the person who stopped to breathe. If you don't want to have TB, stop breathing. Then you will never get it. That I can guarantee you 100%. And I'm repeating myself. If you don't want to have TB, just stop breathing. You will never get it. As long as you breathe, you will definitely get it. And that's how big this problem is. So at this juncture, I'm Deputy President. This fight against HIV and AIDS is his official delegation. He's the Makulubas of TB and HIV and AIDS. And many other programs, he's the Makulubas of it. That's why we called Makulubas personally to launch this campaign. You know, DP, there was an army commander. There was an army commander who has never gone to church. I don't know whether he was an atheist or not, but he didn't go to church. But he knew from teachings that when there was trouble here on earth, God sent his only son to come and deal with that trouble. He knew that. So one day he was faced with a war. And he was so scared that for the first time in his life, he started praying. He never prayed before. He started praying and he said, "Oh God, I was told that when there is trouble on earth, you will send your son to come and deal with it. But the trouble I'm having now, this war I'm faced with, is so big that there's no place for children. I want you to come personally this time. Don't send your son. Come personally and face it." So in this battle, the DP never sent me. He came personally because it's a big one. And I'm not saying you are God, DP. I'm not saying that. All I'm saying is to show the country that this is a serious battle. You came personally. You didn't say I'm delegating the minister to deal with it. That's how serious is it. Can we all stand up to welcome him, please? DP, the floor is yours.
Yeah, this is fine.
You may be seated. Thank you very much, Ms. Motsoaledi, Dr. Aaron Motsoaledi, for the introduction. Let me also thank our program director, MEC Nomagugu Simelane Mkati, our MEC for Health in KwaZulu-Natal, for steering the program for us. Greetings to our gracious host, Premier of KwaZulu-Natal, Siyabonga Premier, for agreeing to host this event this year. Ministers who are here, members of parliament, the chairperson of KwaZulu-Natal Provincial House of Traditional and Khoisan Leaders, Ubaba Nkosi Chinga, namanye amakhosi akhona ngaphakathi kwethu. Let me also acknowledge all the MECs of health who came from our different provinces to join us today. We thank all of you MECs for having come all the way this campaign. We also thank all the MECs from KwaZulu-Natal who have joined the Premier here today as we launch this campaign. I want to recognize the person of SANAC that I work with, my co-chair, Dr. Lindu, who's here. He spoke earlier. The chair of the Private Sector Forum also spoke earlier, Dr. Sekfatso Hopan, the patron of Global Alliance in South Africa, Mrs. Humile Mashatile, the CEO of SANAC, Dr. Tembisile Tulu, President of SALGA, Babu Beki Stofile, Executive Mayor of Cook District, Councillor Skumuzo Mgadi, Mayor of Enkonyeni Local Municipality, Councillor Zodwa Mzindle, na wonke Mayor akhona namhlanje la ngaphakathi kwethu, the MMCs, the councillors, we recognize all of you, the representative of COSATU, standing in for President Zingiswa Losi, President of SALGA, Abafundis, and all faith-based leaders of communities, members of the media, distinguished guests, and our choir that says so nicely. We recognize you and greetings to you. Distinguished guests, sanibonani nonke egama lakhe. Ngiyabonga ukuthi ningamukele nalaba ngihamba nabo bonke la egama lakhe namhlanje. Ngithanda ukuthi nginitshele ukuthi siyanithanda kakhulu. Compatriots, today we join the global community to commemorate World TB Day. We unite as a nation with a shared purpose to end tuberculosis. This day is both a reminder of the challenges we face, but also a call to action. South Africa has one of the biggest TB burdens in the world, but we also stand on the threshold of real change. Yes, we can end TB, and together we will win. March is Human Rights Month, and last week we commemorated this day in the Eastern Cape. As South Africans, we were reminded of where we come from and the price paid for this freedom. This day was also a moment for us to collectively chart a way forward on where we should go as a nation towards building a united and prosperous South Africa. It is in this context that we should also reflect on the progress made in the fight against TB and HIV-related stigma and discrimination. Program Director, 2 years ago, SANAC embarked on a process to develop human rights charters for key populations in all provinces. This includes human rights issues identified by communities. That process has now been completed, although some provinces are yet to launch their charters. The charter emphasizes the need to protect TB and HIV-related human rights, particularly the need to address stigma against people with TB. The human rights hubs in the provinces, supported by AIDS councils, will ensure that these issues followed up and addressed. An assessment of the human rights program under Global Fund support called for breaking down barriers and have identified the following. Firstly, there is a need to develop national level plans for scaling up and institutionalizing HIV, TB, and human rights training for health workers and law enforcers. The next financial year will be key in developing these plans. Second, TV programs remain underserved compared to HIV and human rights programs. There is an urgent need to implement national level TB stigma and discrimination reduction programs and to engage community level networks and organizations in district level efforts to prioritize in the next financial year. The stigma index report by people living with HIV is also being finalized, and the recommendation from the survey will guide the country's response to TB and HIV stigma. I'm also aware that SANAC is also in the process of developing the next human rights strategy for HIV and TB, which will strengthen and guide the country's human rights interventions in alignment with Goal 1 of the National Strategic Plan for HIV, TB, and STIs, which speaks to breaking down the barriers. Ladies and gentlemen, TB continues to claim too many lives around the world. In South Africa in 2023, 270,000 people were diagnosed with TB. And tragically, 56,000 lives were lost, which translates to 153 people every day. TB knows no boundaries. It affects people across all communities, but the burden falls most heavily on the poor and the vulnerable. Furthermore, in 2023, an estimated 58,000 people with TB were not diagnosed. These are our mothers, our fathers, our brothers and sisters, people who deserve and dignity. We must reach them. TB is not just a medical issue, it is a human rights issue. Everyone, regardless of their background, deserve access to life-saving treatment. South Africa is among 30 countries that account for 87% of the global TB burden. It is also among the 10 countries battling the triple burden of TB, HIV, and other TB co-infections, as well as drug-resistant TB. Yet, TB is a disease that is preventable and perfectly curable, even if one is living with HIV. We must therefore work much harder to change this situation. Hence, before we started the program, we visited families today that require support. I urge you, Premier Ntuli and MEC Simelane, that this should be our daily program. We must visit families, as prevention is a foundation of primary health care. This is the other reason we have this commemoration, which is to remind ourselves that TB is out there and it kills. However, TB is curable. We, all of us, hold the power to end it. Compatriots, the government is maximizing efforts towards defeating tuberculosis by using this day to intensify the following 4 critical objectives. The first one, to raise awareness by promoting preventative measures, early diagnosis, and effective treatment. Second, to promote access to care by providing universal access to quality healthcare services, including psychosocial support for everyone infected and affected by TB. Third, to advocate for research and innovation for the development of new vaccines, diagnostic tools, and also treatment to end TB.
Sicela abantu bahlale phansi siyaxolisa TP. Sicela abantu bahlale phansi okhipha ukudla lapho akuvali ukudla kwazi ukuthi TP esakhuluma. Sicela amaMarshals awasize akuvali ukudla laphana kuzophuma uma sekuphela iprogram. Siyabonga. Siyaxolisa TP.
Thank you, Program Director. The fourth one. The fourth one is to strengthen partnerships for collective approaches through multi-sectoral role players, including governments, health organizations, civil society, and the private sector to share resources. Through these 4 objectives, we hope to strengthen TB prevention, improve treatment success, including for people living with HIV, strengthen linkage of people diagnosed with TB to treatment and care, as well as reduce TB-related stigma, discrimination, and other forms of human rights violations in our communities. Compatriots, in line with global community, this year's official commemoration theme is, yes, you and I can end TB. This theme has been retained, however, it now features the tagline, commit, invest, and deliver. The emphasis is on leaders championing TB efforts in our respective constituencies. The theme also promotes individual action as a means of contributing to the national effort against tuberculosis and using the phrase, you and I. You and I, Bondabe Zita, our esteemed traditional and Konsai leaders, underscores the importance of personal accountability and collective efforts in eradicating tuberculosis. We rely on your support and collaboration to eradicate tuberculosis as a public health threat, especially in our rural communities as well. You and I is a statement of intent designed to encourage individuals to take charge of their health. It is in line with the Cheka Impilo National Wellness Campaign objectives, as well as the country's efforts towards finding the missing TB patients. Today, we are launching the End TB campaign, aimed at testing 5 million people by the end of March next year, and annually thereafter. This will in turn result in a 29% reduction in TB incidence and a 41% reduction in TB mortality by 2035. Under SANAC coordination, we will embark on a mass mobilization drive to rally all South Africans behind the End TB campaign. We will work with community leaders, traditional leaders, and media platforms to spread the message that TB is preventable, is treatable, and is curable. Individuals who are in close contacts of confirmed TB patients will be tested regardless of symptoms, as the minister said. People living with HIV will also be tested for TB annually, and individuals who have completed TB treatment are to be tested for TB twice a year after treatment completion. By this time next year, we would have found and tested more than 5 million people. We have the will, we have the infrastructure, and we have the resources to do so. Even with all the TB challenges you have heard about today, South Africa is still a global leader in the introduction of novel TB drugs and treatment regimens, as well as innovative diagnostic tools and approaches. We are now standing at the threshold of a TB vaccine breakthrough. The M72 TB vaccine trials conducted in South Africa have so far yielded promising results. We are indeed readying ourselves for local manufacturing and a rapid national rollout once all procedural protocols have been met. Our country was among the first to roll out the daquilin as part of National Drug-Resistant TB Treatment Program, replacing the older injectable drugs. We have also pioneered the implementation of shorter all-oral medicines, significantly improving treatment, or rather treatment outcomes, and reducing side effects for patients. This is a clear demonstration of our strong commitment as government in the fight against TB. Of course, we cannot look at TB in isolation from HIV. In the face of high co-infection rates, we must respond to the two epidemics concurrently. That approach is one of the main reasons behind the push for the integration of services at our health facilities. South Africa has an estimated 7.8 million people living with HIV. And while 7.5 million of them know their status, only 5.9 million are on antiretroviral treatment. From these figures, it is clear that the country is making significant progress towards achieving the UNAIDS 95-95-95 targets. However, significant challenges persist with the second 95, as the minister said, which speaks to initiation and retention of treatment. The country is currently sitting at 96, 79, 94. So you can see the problem of the second 95 because people are not coming forward, are not taking treatment. So we want to emphasize that we need to please take our treatment. Program Director, in response to the gap in the second 95 target, the Minister of Health through SANAC launched HIV treatment campaign called Close the Gap, which was launched last month. This campaign aims to find 1.1 million people who know their HIV status but are not on treatment. And we want to ensure that we find these people by December of this year. The campaign will leverage existing interventions such as Better Men for Tomorrow, Men's Health Campaign to increase demand for HIV testing, treatment, and prevention. The 1.1 million figure is broken down by provinces, MECs, so you will know what number is in your province. And each province has been given their own targets to reach. We will call on all premiers working with their provincial AIDS councils to make this campaign a success. When we educate people about TB, one thing that we don't typically address is also the importance of hygiene and cleanliness. Although TB is transmitted through airborne particles, when an individual with active TB coughs, sneezes, or speaks, for us, hygiene remains crucial for maintaining overall health and preventing other infections that can exacerbate tuberculosis. Now, I know you can't do what Minister Motsoaledi was saying you should do to avoid contracting TB. He said you must stop breathing. Now, no, you can't stop breathing. But it's important that we also must try and live in environments that are clean. In that regard, we agreed with Salga that one of the things we're going to do, and this campaign will be launched very soon, is what we call a Clean Our Cities campaign. This campaign will be throughout all provinces in our country, and as a presidency, we will be working with Salga and other government departments to go down to provinces and work with them. And it's not going to be a one-day, once-off campaign. It's going to be a way of life. So we're going to be cleaning and cleaning and cleaning all the time in our communities. Compatriots, since last year, South Africa has also made significant strides in data-driven health responses. TB Day last year. The SANAC Situation Room is a state-of-the-art data consolidation and visualization. The SANAC offices in Pretoria, but it is accessible virtually from everywhere in the world. During the launch, we stated that South Africa generates large data across various parts and entities. The data exists in silos, and that fragmentation is due to lack of a central data repository and management point, which we are now dealing with. So the SANAC Situation Room has now been set up, and to precisely deal with this challenge, to ensure we do away with the fragmentation and be able to coordinate our interventions properly. Program Director, accurate and quality data enables us to review trends and assess progress in our efforts to address epidemics of HIV and TB. This in turn assists decision-making and the effective allocation of resources towards interventions. Since its launch, the platform has seen an increase in users interacting with it, using the available data more frequently. Currently, the platform is moving towards developing public-facing real-time dashboards to close the information gap.